Welcome to Insights from the Healthcare Intelligence Network, highlights from our ongoing webinar series for healthcare executives.
This is Melanie Matthews. Today's program is the Embedded Case Manager in the Healthcare Continuum. Just as the news industry embeds reporters in military units engaged in armed conflict, healthcare is stationing case managers at the front lines of care to wage war with fragmented delivery and high costs. Today's case managers are co-located with primary care practices, emergency room staff, and hospital admissions and discharge teams to help identify and manage high-risk patients and reduce avoidable utilization of services. 2011 market research by the Healthcare Intelligence Network identified sharp increases in embedded case management from 2010 to 2011. The number of case managers embedded in hospital ERs rose 60%. The number of case managers embedded in hospital admissions areas doubled, and the number of case managers embedded in hospital discharge planning departments rose 34%. Geisinger Health System first embedded case managers in select primary care practices when it rolled out its Proven Health Navigator medical home pilot in 2007. Geisinger recommends a little advanced planning before embedding a case manager in a practice to help ensure a successful placement.
When you're first starting at a site and you're embedding a case manager, and we talk about the team concept, you certainly want them to understand that she's an integral part of the team. But again, you have to be careful with her time management and her efficiency. As you roll out your model and you're talking to your providers and you're educating them as well as your staff, you have to be very specific how you introduce her role, explain her role, and educate the site as to what she'll do.
Bon Secure Health System fashioned its embedded RN nurse navigators on the Geisinger model, supporting them with homegrown care improvement tools and retooled workflows such as a daily huddle to review incoming patients.
The RN, Embedded Nurse Navigator, responsibility is to do telephonic outreach to the patients on that list, on that registry, within 24 to 48 hours of discharge. They're to do medication reconciliation and education. They are to do red flag rehearsal. In other words, make sure the patient understands signs and symptoms of worsening condition. And then they are to schedule the patient for a follow-up visit within 5 to 7 days of discharge.
Organizations should also advocate for a case manager in the hospital emergency room where there are several key targets for case management intervention. Blue Thorn Medical Center benefits on both a clinical and a financial level from a case manager embedded in its ER.
Each hospital should take a look at a couple of things. One would be the diagnoses that you're seeing mainly being affected by medical necessity denials. Using your ED case manager as your first line of defense and looking at those soft admissions that may be resulting in admission denials will help you with your RAC audits, number one, and also should reduce your number of 1 and 2 day short stay patients, which are also vulnerable for RAC auditing. In addition to that, I would look just generally at, as is listed here, nursing home patients, because many times if we intervene on those patients, we can prevent an inappropriate admission. And finally, I would also target anyone who had been in the hospital within the last 30 days.
The Embedded Case Manager promises to further impact healthcare delivery, cost, and quality. This is Melanie Matthews for the Healthcare Intelligence Network. HIN has many resources defining the case manager's role in the healthcare continuum. 2011 Benchmarks in Case Management, Best Practices in Contemporary Case Management, The Guide to Patient-Centered Case Management, and the Case Management Answer Book, Volume 1.
Thank you for watching Insights. Please call our customer service department today at 888-446-3530 or visit us at store.hin.com.